I think it is. Good morning, everyone, and welcome to Alumni Reunion Weekend, which is always a high point for the medical center and for the university in general. And today, it's an unusual day in which we're going to celebrate it virtually, and it's a sad day as we, around the state of Kansas, are celebrating the life and loss of Reggie Robinson, who was one of our most distinguished alumni at the university, also a leader throughout the state and throughout the university. And so we remember Reggie as we celebrate our alumni who are so meaningful to us. We're going to host a variety of university events throughout the day, including celebrating our esteemed 2020 Alumni Award recipients. And tomorrow's agenda is left to individual classes for class reunion events. Of course, our celebration looks a little different this year, and we appreciate everybody adapting with us for the health and safety of all involved. This pandemic has affected many of our plans, but it's also given us a chance to show just how resilient our Alumni Association team is and the university in general is. Joining me today are the deans from our three respective schools and campuses, and I'll be eager to introduce you to them soon. But before we hear from them, I wanted to give you a bit of an update on what's happening campus-wide and statewide at the medical center. So after all four of us have given our updates, we're going to be excited to open the floor to questions from our guests and our alumni. So this pandemic hit us like it did many across the country rather abruptly in early March. And our team pulled together to really focus on three activities. That is the safety of our students, faculty, and staff, the continuity of our key missions of research, education, and outreach, and finally, how we could be the best partner with our healthcare provider communities across the state. In terms of safety, that really started with a very rapid depopulation of our campuses. And when I say rapid, I'm talking about hours, not days or weeks. And when I talk about depopulation, it was a depopulation of just about all aspects from our campuses. And that took place basically over a 24-hour period in early to mid-March. In terms of safety, that has continued through identifying the need and use and obtaining PPE for each part of the activities. And it included actually removing our clinical learners from their clinical learning environments. This removal was done in partnership with our health system partners and across the state, but also with our accrediting bodies that guide that help guide our actions. And so for the early parts of March and April, we were a pretty quiet organization with our activities taking place outside of campus. And our leaders, the deans that you'll see this morning, we're all engaged in the plans of how to get people back on campus. In terms of continuity, our education never stopped. We changed the way we did it. We have been blessed by having regional campuses for the last 50 years. And as such, we've been providing education at a distance from 39th and Rainbow to Wichita and vice versa for a long time. So when we needed to move to an off-campus primacy for education, we were able to do so very seamlessly. I actually think we probably did it as good as anybody in the country, and we're very proud of that. So our education continued. It continued up until we were able to graduate classes from the schools of medicine, nursing, and health professions on time and get those key graduates out into additional training and into the supply chain across the state and across our country. So we were able to continue the continuity of our education. In mid-May, we were able to start to move our learners back into the clinical learning environment and continue our clinical education. Led by our leaders on the research side, we were able to reopen our laboratories in early May. and to repopulate them in a safe and effective manner. Our clinical research, which quite frankly had to be expanded to meet the needs of the COVID pandemic, never stopped for the most essential clinical trials. And then in the mid-May to late May timeframe, opened up for the majority of our ongoing clinical trials. So our research mission, while it was delayed somewhat in the March to April timeframe, came roaring back in May. And that was, while it wasn't on the cutting edge across the country, it was certainly in the top 10 to 20% of reopenings of the scientific enterprise. And we really didn't miss very many beats at all on the scientific side. As we started to think about the next semester, the fall semester, which really takes a rolling start here in Kansas City, with the School of Health Professions and the School of Medicine really never stopping. Then the first and second year classes of medicine, health professions, and nursing coming back throughout the summer and the fall. The deans got together and highlighted what kind of capacity the room usage would be on our campuses, and restarted the programs in safe but somewhat diverse ways with the School of Nursing. And I'll let Dean Miliski tell you about their approach, and Deans Akinwuntan and Ojo telling you about their approach, but really taking a primacy on safety. When it comes to our partnerships across the state and in our communities, our students and faculty were immediate participants in the fight against COVID-19. And that included, in fact, some of our graduates from School of Health Professions and School of Medicine graduating early and joining the fight on the front lines across our state. It involved folks from all three of our schools becoming contact tracers and providing care. And indeed, in many ways that some of us will never know, there were students pitching in to help babysit for learners on the, or practitioners on the front lines, and helping out in ways that are too numerous to mention. We were also led throughout the state by faculty members who serve as community and county health commissioners, and that includes Drs. Corvo and Griner in Wyandotte County, Dr. Lemaster in Johnson County, and Dr. Mins in Wyandotte County. And I'm sure there's others who have participated across the state in leading the environment. Dean Mosier in Salina was a leading voice for public health, and Dean Ojo in Kansas City, and a team led by Tammy Gurley Calvez and others worked feverishly to put together prediction models to help both repopulate our campus, but also repopulate the campus in Kansas City. And that's not even to mention all our faculty who provide frontline care across the state of Kansas in treating patients with COVID. When we entered this pandemic, I was convinced that we were going to do exceedingly well. And the fact is that it was based upon the team we had as part of the university leadership. And I think that has been incredibly important. We have done well, and it is because we have outstanding leaders and faculty and staff, and our students are committed to get us through the pandemic. One of the most important means of communication that we've had as a community, in addition to what seemed to be countless and endless meetings on Zoom, is a town hall that we have supported on Thursday afternoons since the very beginning. In a typical year at the medical center, there might be 4 to 6 face-to-face town halls. Since March 17th, we've done 26. And it provides an opportunity for us to share insights, to share some of our insights from the best and brightest of our alumni, including Dr. Dennison, one of the world's great coronavirologists, who's honored today from the medical alumni, distinguished medical alumni, but also some guests from around the country and around the state. It also gives our students, faculty, and staff an opportunity to ask any and all questions on a weekly basis. And I think it's created a collegiality and a cooperation on our campus that that's broken down a lot of barriers. They've seen us on our good days. They've seen us on our less good days. And I think the students, faculty, and staff have grown in their appreciation for the leadership team during this time. So communication has been a very important approach for us. So quite frankly, the town hall that we have now, the group does a lot of these, and so we're pretty seamless in our capacity to put these on. So we have remained focused on these three issues: safety of our student, faculty, and staff, continuity of our missions, and partnerships across the state with our healthcare providers. And they remain our three guiding lights through the pandemic. But we haven't stayed static. And so if you were on the campus in Kansas City today, you would see some great new features. If you were in Salina, you would see a relatively new health education center. And if you were in Wichita, you would get to interact with a lot of great students and faculty who are changing the Wichita community and the healthcare in the Wichita community. In Kansas City, as I sit in my office in the Murphy building and I look outside, I see for the first time in 100 years, a new entrance to the front of the Murphy building off of Rainbow Boulevard that is both functional and really quite beautiful. It creates an ADA compliant entrance to the Murphy building that's never been present in over 100 years. If we're going to be a welcoming campus, we need a welcoming opportunity to enter our buildings. And it's a beautifully done and beautifully landscaped entrance to the Murphy building as we gear up to celebrate the 100th anniversary of this historic building. If you went down to the corner of 39th and Rainbow, you would see the health education building. Now, the health education building's not new. It's been there since July of 2017, but it's really a hallmark of our campus here in Kansas City, a building that was designed to support education on all three of our schools, and in a manner that provides for interprofessional activities and active teaching. So in the midst of the pandemic, where students were distancing, they were still coming together in safe ways to actively learn how to take care of patients. And that's included interacting with standardized patients. Our standardized patients are really been an unsung heroes of our pandemic. They've allowed us to continue to train our preclinical and clinical learners, and without them, we would have had a bit of a problem here on campus. So we are very grateful to our standardized patients. And in the Zeal Simulation Center, we've been sharing new strategies, both to train folks in the COVID era, but also for our own safety. And Zeal, for instance, did a video about how to care for COVID patients at your home, which has been seen tens of thousands of times by people across the country who ask the question, so now I've got a family member with COVID, how am I going to take care of them? And so that building has really become an epicenter. It's so much an epicenter that the Corps of Engineers came by and thought they might want to turn it into a COVID response center and really like the building. Now I'm hoping we don't have to do that, but they love the building and its multi-functionality. If you go down to the corner of 39th and Rainbow and you head towards the Orr Major building, you would also see a dramatic change in that on the second floor of Orr Major, our anatomy lab is no longer there. So when we built the health education building, the decision was made not to put either offices or wet research or lab space in the building, including gross anatomy. Actually, there had been some discussion about the future of gross anatomy in medical education, but with the building of the Health Education Center in Salina and our collaboration with our colleagues at Newman College in Wichita, we have committed to the continued continuity of gross anatomy on our campus. We still think it's not only a rite of passage, but it's also an important learning experience. So with the help of some of our important alumni, we rebuilt the anatomy lab on the 4th floor of the Orr Major building. So When I returned to Kansas City after 28 years, after graduating medical school and went into the old anatomy lab, I was really struck by the fact that the sensations of being in the anatomy lab had not changed. And the memories that they provoke from our oldest parts of our limbic system were still there. But it was in desperate need of an upgrade, both for student capacity and safety, but for the safety of our faculty and staff who use the facility all the time. So the new space is up on 4th floor of Orr Major, and it's beautiful. It's a state-of-the-art gross anatomy lab that combines state-of-the-art filtration, lighting, audio-visual equipment, and facilities for our faculty and staff. And I would encourage you to visit the Alumni Weekend app to see a 360-degree virtual anatomy lab tour where you can experience this. If you take those all together, the updates in the 2010 timeframe in Wichita, the new building in Salina from 2018, the advancement with the HEB, I don't think there's been a finer time or better time for the facilities to educate our students on our 3 campuses. And our students are very grateful and very thankful for these updates. The other thing is not standing still is our achievement. We've had a number of important research updates this year. We have a newly funded medical science training program. The MD PhD program was funded by the NIH for the first time. This is a feather in the cap of our graduate programs in the School of Medicine and puts us in very elite category of medical centers. Our research funding is really, while I don't like to use the term skyrocketing, it is increasing at double digits, both with NIH funding and clinical trials. And it has been incredibly rewarding to see that 4 or 5 year trajectory. And finally, I don't think there's ever been a time when our communities across the state have depended upon the medical center, the individuals who play a role in the community, in community health, in the care and the direction of our communities. Now, I'm not sure in the past it's been a very high profile position to be a county health commissioner, but think about it. These are our best and brightest colleagues who've toiled in anonymity and now find themselves, quite frankly, on the front pages of discussion about every move. And we've been very proud of the people who've taken that role. Everything from county health commissioners to the nursing and health profession students who've acted as contact tracers through this pandemic. So we're exceedingly pleased. And finally, we're not sitting idly by in terms of research. And there are new research programs in the schools of nursing and health profession, School of Medicine that directly attack this pandemic at its basis. Everything from basic biology to the care of communities with COVID. So we're very grateful. So with that all being said, if you take away that we've been busy and coordinated and proud of our efforts, I think that is all true. And now I'm going to turn this over to my Dean colleagues, and we'll start with Dean Akinlolu Ojo. Dean Ojo, this is his second Alumni Weekend. He is just starting his second year. He started in August of 2019, and Dean Ojo has led during quite an interesting time at the university. So I'm going to turn it over to Dean Ojo for his updates in the School of Medicine.
Thank you very much, Dr. Simari. Good morning. I am pleased to have the privilege to join the 2020 University of Kansas Medical Center Alumni Reunion Celebration. As Dr. Simari pointed out, 209 days ago, the COVID-19 pandemic forced us to make some dramatic changes in this school, in that nearly all learning activities shifted from campus to virtual learning environments, including the clerkships, And these were quickly followed by disruptions to the national standardized testing examinations that was necessary for graduation and academic progression of our students. Despite these major disruptions, our M4s graduated on time. 99% of our graduates marched in the residency marching program, and the class of 2024 also started with 211 students in July. Our M2s and M3s are all progressing according to the academic calendar. A major factor in the success of our continuity of the medical education program is the fact that the School of Medicine in Wichita is one of only 5 medical schools in the country that is certified as a testing site for the standardized national exams, the step 1s and step 2s. So as the ravages of the pandemic continued, when more than 20,000 medical students across the country had significant difficulty in taking their step 1 and step 2 exam, we sent all our students to Wichita to take these examinations. Very grateful for the foresight of Dean Garrod Mims in Wichita for establishing the campus in Wichita as a national testing site more than a decade ago. The class of 2020 was the last year of the legacy curriculum. It acquired the status of legacy curriculum because in 2017, under the leadership of Dr. Simari as executive dean, the school implemented a new MD program curriculum with the incoming M1 class of 2017. The new curriculum called ACE, the acronym stands for A is active learning, C is competency-based, and E is excellence-driven. This new curriculum was recently ranked as one of the 4 most transformative MD programs in the country. All the metrics available to us and to the AAMC indicate that the ACE curriculum is meeting all the objectives of the MD program at a superior level compared to the legacy curriculum. As Dr. Simari had already mentioned, our MD PhD program started in 1996. The MD PhD program is called the Medical Scientist Training Program only if it is funded by the NIH. In July 2020, under the leadership of Dr. Timothy Fields in the Department of Pathology, our MD PhD program was funded by the NIH for the first time since its inception 25 years ago. We are now one of 50 medical scientists training programs in the country among more than 100 medical schools who have MD PhD program. As Executive Vice Chancellor Simari already noted, research programs and research funding are increasing substantially. During the last academic year, we crossed the 100 million mark in total research funding for the school. Our NIH ranking also improved significantly. Among 142 medical schools that are ranked by the NIH, we were number 67 in 2016, we were number 65 in 2017, we were number 64 in 2018, and we were number 59 in 2019. Our goal is to be in the top 40 within the next decade. In January 2020, we launched a comprehensive rural health task force. The task force is detailing multiple strategies for statewide partnership among the schools, the communities in Kansas, healthcare providers across the state. The task force is focused on building a Kansas Center for Rural Health, which will serve as the hub for education, research, and service to be located headquartered in Salina under the leadership of Dean Robert Musa. The task force is helping to figure out how to develop rural track residency training program, how to leverage practice-based clinical trial networks, how to facilitate statewide partnership and functional collaboration, and how to extend and grow our pipeline to recruit individuals from rural parts of the state to come to our medical school and train them to be able to return to their communities to practice. I also encourage everyone to take time to look at the video for the new anatomy facility, which would not have been possible without the support of the alumni. We thank you for your generous support. I conclude by expressing our gratitude to you on behalf of the school for your ongoing support to foster the continued growth and success in meeting our mission, which is to improve lives in communities in Kansas and beyond through innovation in education, research, and healthcare. Thank you.
Thank you so much, Dean Ojo. And now it's my pleasure to introduce Dean Sally Maliski of the School of Nursing. Sally?
Well, welcome everyone. It's so good to have you all here virtually. Certainly a lot has changed since we were able to be together in person a year ago. It certainly has been quite a year. As Dr. Simari said, around mid-March, we went all online. Fortunately for the School of Nursing, our graduate programs have been online for years, online hybrid. So that includes so is our RN to BSN program and our KU Community College Partnership programs. So the only program that was significantly impacted is our traditional BSN program on the Kansas City and Salina campuses, our School of Nursing at both campuses. Through the creativity and dedication of our faculty and staff, we were able to provide our students with high quality virtual learning experiences during this time. And fortunately, because this hit towards the end of the semester, the critical clinical learning experiences had been completed and competencies have been assured. But with the virtual learning opportunities, all of their required competencies were able to be met, and they graduated on time, which we are very pleased about. That includes both our traditional BSN graduate students and our graduates, our master's, our PhD, and our DNP students. During this time, our School of Nursing leadership set up a weekly series called Living and Learning in the Pandemic, which provided opportunities for faculty, for students to keep abreast of occurrences as they were happening in the situation, and to also provide support and a time to express concerns, challenges, and successes that were happening during this time. So after getting through graduation, virtually of course, during the summer, we were still able to offer our online electives. Unfortunately, we weren't able to offer the elective in pediatrics at Children's Mercy because of COVID restrictions. But this is an elective course for students who wanted additional pediatric experiences. All experiences and competencies have been met and are continuing to be met by our students. Also, during the summer, we learned that one of our DNP students who went to St. Louis to help in the frontline activities in that city when it was hard hit, contracted COVID-19 herself and was in intensive care on a ventilator for a number of days. She really showed, and I'm happy to say that she's recovered. She is rehabilitating now, and very happy to say that she's doing well, but really represented the spirit of our nursing program, our nursing students, and our nursing graduates in stepping up and meeting the extreme challenges faced. So in anticipation of a fall semester that was going to look and does look very different than previous fall semesters, our faculty and staff worked above and beyond during the summer to really design a model that would provide the best learning experiences possible for our students while still maintaining safety for students, staff, and faculty. And the result of that has been an alternating on-campus, online hybrid model. And again, this is for our students who were traditionally on campus all the time, our traditional BSN in Kansas City and in Salina. With this, students are pleased to be able to at least be on campus part of the time. We're able to conduct our clinical skills education on campus, and all of it, of course, with appropriate PPE and distancing. And I'm happy to say that our applications and enrollments were not decreased. In fact, for, again, our BSN program, we had over 300 students for the 114 admissions we were able to do in Kansas City. And now our increase in size, our Salina School of Nursing is continuing to increase, and we admitted 24 students, new students into that program. So that continues to grow. Fortunately, in working with our clinical partners for this semester, our students are able to have clinical experiences. And in addition to that, our faculty have designed some new community-focused experiences, such as working with the public health department for our students to have clinical experience, accredited clinical experiences in contact tracing and case investigation for our DNP students. These students, I feel, our graduates of 2020 and 21 are actually going to be much better prepared for the new realities that they're facing. They will be more resilient because they've had to be in their educational experiences, and they will be more adept at rapid change processes, as well as being better prepared for epidemic and pandemic situations from a more global public health perspective. So these students are going out with new and advanced skills. Going forward, we have a number of COVID-related research studies underway in the School of Nursing. We have started a partnership with the Center for Design Research and T-Mobile, in which we are adapting and developing the use in partnership with augmented reality and virtual reality technologies to revolutionize nursing education that will have tremendous applications for our online education. And we have a number of new innovative practice partnerships with agencies in the area. We've also added on to our HRSA-funded rural health nursing programs that started, you may have heard about it last year, with our pre-doctoral concentration in rural health centered out of Salina, in which we were able to give immersive experiences to DNP students in rural practices. That now led to awarding of a HRSA grant, where we have developed a postdoctoral fellowship, a postdoctor of nursing practice partnership that is focused on rural health skills and competencies, working with partners with critical access hospitals and with practices across the state to develop the skills both for didactic and experiential learning. So I would like to end with a real high point, the high point of our fall semester, or the starting of our fall semester, and that is the Nightingale Ceremony. This looked very different than it had in the past, but was not at all diminished. Students on our Salina campus and on our Kansas City campus were spread out on individual tables, separate tables, in the Health Education Center in Salina and the HEB in Kansas City, with their white coats folded in front of them. The presentations were a combination of both virtual and in person. And when it came time to don their white coats, all the students stood together, donned their white coats, and there was this whoosh in the room as all the students in unison put on those coats and stood there in unison, all in their white coats. They were then able to come to the microphone and announce their name and where they were from. All of this was live streamed, and it was truly a very stirring moment that transcended the COVID-19 situation. So with all this, I hope you can see that your School of Nursing is not only surviving, but it's surviving through this whole situation. So thank you, and rock chalk.
Thank you, Sally, for those comments. And now we're going to introduce Dean Abiodun Akinwuntan, who is the Dean of the School of Health Professions, to update us on School of Health Professions. Dean Akinwuntan.
Thank you very much, Dr. Simari. To all participants on this Zoom call, I say welcome and good morning again. So I have a long list of accomplishments that the School of Health Professions has been experiencing. But first, let me thank all our alumni for their continued support, and without which we will not be able to accomplish the things I have to report on today. And I also want to thank our faculty, staff, and students for their resilience, flexibility, and cooperation during this difficult time. Our school successfully adapted to all the challenges that came our way in the last few months. We came together as a group and remained focused on our mission to serve the citizens of Kansas, the region, and the nation, and to develop tomorrow's leaders through exemplary education, research, and service. Although we still have a long road ahead, I truly believe that we collectively have what it takes to rise to the challenges. And here are some of the accomplishments. We, 13 respiratory care students joined the early graduation group at the end of April to join the workforce, and were all immediately deployed in the front lines. Our other students, all of them in the class of 2020, graduated on time during the May graduation ceremonies. We had a total of 286 students on campus during the summer semester who successfully completed their academic training. All of these were done maintaining safe distancing, wearing adequate PPEs, and making sure that everybody obeyed all the sanitary recommendations. We filled all the spaces for our new incoming students and returning students as well. Hence, our enrollment numbers in the School of Health Professions has been on the steady increase for 5 consecutive years. We were approved during this period for 2 new programs, which is a Master's of Science in Athletics Training, for which we have hired a program director who started virtually with us in March and has done a phenomenal job getting us ready for accreditation. We just were recently approved for a Master's of Science in Genetics Counseling as well. Our students continued to work and rendered telehealth services to patients through the Audiology Clinic, the J-Start Clinic, and the ALS Clinic. So with all of this, a good number of our students continue to win state and national awards for their service and academic accomplishments. All our programs continue to be accredited, with most receiving commendations for their flexibility and their ingenuity in adapting to the current situation. 5 programs in our school that have a means of ranking continue to rank amongst the top 20 in their different disciplines amongst all public schools. And similar to the data that Dr. Ojo presented on research growth in the School of Medicine, we have a similar story in the School of Health Professions. Our rankings for the School of Health Professions, we ranked 29th in 2017. We improved significantly to number 17 in ranking in 2018. And as of the last ranking, we rank in the top 15 in the country. Our goal and our aspiration is to rank in the top 10 within the next few years. I cannot be prouder to call the School of Health Professions home. I have no doubt that we will continue to adapt as needed to successfully overcome all of our future challenges. For that, your continued support as alumni of the School of Health Professions remains very important and critical to our success. I offer my best wishes to all of you, our hardworking faculty, staff, and students, for the successes that we have accomplished and the many more successes that we still have ahead of us. Thank you.
Thank you, Abiodun. And as we would ask people who have questions, please go on the chat line and add to those questions. You know, the Alumni Weekend is always special. I would like to say that there's something particularly special about this one. Number one, we're recognizing, the School of Medicine is recognizing Kim Hewitt, who was the prior director of the alumni activities on our campus with the honorary medical alumni, and that's just a great achievement and recognition of Kim's leadership of the Alumni Association. And we appreciate Jordan Snow's taking over and doing such an outstanding job with today's activities. Now, some people might say there's some coincidences, but I don't believe in coincidences. So some might ask, well, what's the Jayhawk impact on COVID beyond the things that you've discussed? Well, many might not be aware that that the development of remdesivir and its application really has 2 Jayhawk imprints. One is Dr. Mark Dennison, who's receiving the Distinguished Alumnus Award, as I mentioned, one of the great coronavirologists in the world. And then Dr. Val Stella at the main campus in Lawrence developed the beta-cyclodextran, in which remdesivir is dissolved before treatment. So we're very proud of both of those activities. And then, lest we forget, Dr. Barney Graham, who was our medical distinguished alumni last year, is one of the co-director of the Vaccine Research Center at the NIH, was one of the main drivers, developers of the Moderna vaccine, which is in its late stage of testing, the mRNA vaccine. And then we have vaccines being tested on campus, as well as testing of convalescent plasma and other activities. So you can rest assured that your fellow alumni are making huge differences in this pandemic. So I'm going to go to the chat. Natalie, are there questions that we can answer?
There are. We've had a couple of different questions. One, my
Natalie,
apologies.
No, that's okay. Well, I will look for myself.
Actually, I'm back on and I can read it now. My
Perfect.
apologies.
No, that's okay.
the first question was, are there comments that we have in comparison between the COVID response and the KUMC faculty response to World War II and the war's disruption of the school's mission? It was the end of the era for Dr. Delp.
Yeah, so, you know, I could say something disrespectful like, Dean Mins, can you help us with the World War II? But I'm not going to do that because I don't want to be disrespectful. Just a comment, though. This pandemic has been a pandemic of we and us, not a pandemic of them. And as such, I would say that you have to go back to World War II before there was as widespread community engagement in this national effort and back to the Spanish flu to think about that. And so I think this has fully engaged the community. Now, for our 50-year graduates, many of whom went off to conflicts around the world of Vietnam War at the time, I'm sure that you're thinking, well, we were all in on that one as well. I stand in full respect of that. But I would say that our leaders at the university were leaders with the Spanish flu, which Dean Crumbine took an important role, and in World War II. Gerald, I don't mean to put you on the spots, but do you have any thoughts about, you know, how that might have differed in different pandemics or conflicts?
I don't know a whole lot about World War II. I read some about what the effect it was on the medical school. I know that a number of the faculty actually had to be deployed overseas. So that led to an issue of how we continue to provide our training with many of our faculty elsewhere in helping our soldiers overseas. So I'm sure that created a quick dilemma for them to resolve about how to recruit additional faculty and make sure their students could continue on. As I also recall, I think they had an extra class squeezed in during World War II, so they had extra students despite fewer faculty. So I admire their resilience then, because that was probably more challenging than what we've had to face. But it was similar. We had to, on the quick adjustment, decide how to take care and continue our clinical training, and despite the fact that our hospitals were not able to handle our students. And so we had to be, we were very fortunate that there was a lot of training, a lot of videos online that we could use to show our students how surgeries are done, despite the fact they couldn't actually watch actual surgeries on that last clerkship. Fortunately, all of our students had the previous 10 months of clerkships, so most of them have already had some surgical exposure and whatever. So I see some similarities there, but fortunately we didn't lose any faculty who had to leave campus and be deployed.
Right. You know, last year at the 50th anniversary breakfast, we heard some stark stories about students in Kansas City that were persevering in spite of riots and part of Kansas City on fire. And I think some of us thought that was a distant history. And yet this spring, we've seen some of the same, perhaps not riots, but certainly some vibrant protests on our streets. And so history has come back in many ways. Natalie, other questions?
Yes, we had a question for Dr. Miliski about the Nclex pass rate for the 2020 BSN class. Sally, I know you responded in the chat, but do you want to talk about that a little bit?
Yeah, no, we were, needless to say, a little nervous coming up on the Nclex rates or exams with the disruption at the end of the semester. But despite that, our first time pass rates, which are the ones that count, are over 90%. So we're pleased with that. It's not as high as we would like it, but it's above national and state.
Yeah, so I think we've seen across the schools that there are certain aspects of test prep that really do benefit from students being together and to being monitored. And this is not as just simply a School of Nursing concern. It's a concern amongst us all. And we are anxious to get back to that fully engaged opportunities to provide those experiences for students. I don't know, Dean Ojo, do you feel that the same way? You're on mute.
You are correct, Dr. Simari. I agree completely that it has a uniform effect across all our students group.
Yeah. It's an excellent question. Next question, Natalie.
The next question is, are you designing any research projects looking at the long-term biopsychosocial cultural effects of COVID? Seems like this would be a great research project involving all 3 schools.
Yeah, that's a great question. This is when I think of the term pandemic, I think of multiple epidemics that are taking place at different times in different places. And this is certainly an epidemic of proportions that are outside the viral nature. Sally, do you have any comments about that sort of interdisciplinary outcomes?
Yeah, absolutely. We've got a national study going on that initially is looking at COVID's impact on nurses using validated promise measures. Plans for that, as we're looking at it, and we have talked with some others, is to expand that to look at the impact of COVID on other health professions. So right now we're looking at nurses in acute care community, school nurse, and long-term care facilities. But we also want to, and we've had requests to extend that to PAs, respiratory therapists, and others, that it's a wonderful opportunity for interprofessional collaboration.
As I mentioned, this pandemic is really a combination of local and regional epidemics. Dean Mins and we in Wyandotte County have gotten to see it from a more of an urban and suburban perspective. Dean Mosier has seen it more from a rural perspective. Dean Mosier, how would you compare the pace and tempo of the pandemic in Saline County and Salina with those that you've witnessed in Wyandotte and Sedgwick counties?
Yeah, it was interesting. Obviously, the spread of the epidemic was concentrated in most of our larger metropolitan, as you would expect with global movement and whatnot. But I think as we engaged with a number of rural health systems across the state in preparation for their COVID response, we saw similar activities here in Salina. A little bit of resistance to, some of the face mask mandates and social distancing, and close your schools, sports activities and whatnot were quite hard. That's a backbone of a lot of rural community activities, obviously. And they didn't see their numbers pop. So they, I think, got lulled into a sense of, they're more isolated, less densely populated. They maybe didn't have as much to worry. But as we've seen with the second and now perhaps a third wave of increase in cases, we're certainly seeing the numbers pop a little bit more rapidly across rural Kansas. And we're seeing that here locally in Salina with every 2-day numbers that are reported popping up a little bit more, the hospitalization rate up a little bit higher. So that's drawn them all to step back and think about as we approach the flu season, what's this going to mean as far as the capacities for the smaller hospitals and even our regional medical centers in being able to manage a larger increase in the requirement for hospitalized COVID patients. So it's an awakening that's happening, and a little bit of an alarm perhaps being raised, and appropriately so at this point.
Thank you.
I add, for those who are not living in Kansas, they may not know, but while Bob is correct, in most of our rural counties, the epidemic has not been as impactful. But in southwest Kansas, where our beef packing plants are, it has hit those communities tremendously, probably more severely than our metropolitan areas. And they continue to have problems keeping those beef packing plants going with the number of cases they're seeing in their employees. So, as a matter of fact, most of our ICU patients in Wichita are now patients that have had to be transferred to our hospital here from southwest Kansas. So that's a unique rural area that's really seeing as much problems as our metropolitan areas.
When I returned to Kansas in 2014, I remember Josh Freeman was teaching on the social determinants of health. And quite frankly, I'm not sure how much inroads he was getting amongst students and faculty. And we, this university has really driven that home in all of our schools. And our students have seen the social determinants driving outcomes in this pandemic, unlike anything we've ever seen before. And the rural-urban divide is certainly one of those. So, boy, I tell you, our students are getting a firsthand look at public health and the impact of social determinants. Natalie, any other questions?
Yes. The next question is, Kansas was one of the first states with telemedicine. Can you comment on the impact of telemedicine during COVID?
Yeah, I'm happy to have any of my dean colleagues weigh in. We were one of the first states and one of the best states. And on the university side, we continue to be involved in grants and in innovative opportunities in all the schools on telemedicine. On the clinical side, the health system has sort of actualized that in clinical practice in ways that we could have had meetings for years to try to get 10% of our practice in telemedicine, and instead, in 2 weeks we shifted 90% of the practice to telemedicine in the March-April timeframe. So there was a wide-scale adoption of telemedicine, and the technologies which were sometimes in the past burdensome and expensive are now, can be your phone and the internet. So we were ready, we were capable, and it really provided a great opportunity. And it's the barn doors are open, and we're not putting that back in the barn. There's still a lot of people going to get telehealth across the state. Any of my colleagues, Gerald, do you want to make a comment?
Yeah, I might add that our clinical operations had to convert over to a lot of telemedicine very quickly. But we took advantage of that. So our students who could not go to the hospital or to the private clinics for those 2 months were quickly recruited, and they got a lot of experience in what telemedicine is. And I'd say our students probably benefited greatly from seeing the capability of telemedicine that they may not have seen had it not been for the requirements of the COVID outbreak.
Right. Abiodun?
May I also add to that? Dr. Mims, you're very correct. Our students also got a unique experience of having to be involved in telemedicine, which without the pandemic would not have been one of the things we immediately thought of. And this was really very helpful, especially for the audiology clinic, the Gesta clinic, because these were patients who were most likely to have been forgotten because they could not go to the hospital. And so being able to reach out to them via telemedicine was really very helpful. They really appreciate it, but it was also a unique training opportunity for our students.
Thank you. Natalie, any other questions? We probably got time for 1 or 2 more.
We do. The next question is, with our appropriate focus on COVID as an academic leader, how can we raise public awareness on influenza to promote vaccination and prevention due to the continued annual mortality?
Yeah, that's a great question, because the number of interactions between COVID and influenza is going to be absolutely challenging and fascinating to see. So we do have a role in spreading the word, both in our community health level as well as in our institutions for influenza vaccination. With that being said, there are these reports from the Southern Hemisphere that it was a very low influenza year. Gerald, Bob, should we feel, Dean Ojo, should we feel better? Is that a possibility here, that we're not going to see much flu, or is that a false pipe dream?
I think there are some evidence on both sides. Clearly, the evidence support the fact that if you have flu or if you have COVID-19, that the initial elaboration of interferon in response to the infection may reduce the chances of a second viral infection, although all those are speculative evidence based on laboratory experiments. And there's also evidence that, in fact, having influenza may predispose you more to another viral infection because of an overall lower rate of immune competence in the context of infection. So I don't think we know how this is going to work out. I think the speculation have some reasonable basis in laboratory experiment, but it didn't turn out that COVID would have a lower rate of transmission in the summer months because of the low rate of infection in the tropical countries. Probably those tropical countries have low rates of COVID-19 because of familiarity and ready acceptance of preventive bundles like mask wearing.
Gerald, any comments?
Well, yeah, no one knows. We'll find out this year. But you know, we've never had an influenza season where it was mandated to wear masks.
That is true. That's
So
absolutely true.
We're hoping that mitigates the influenza as well as the COVID.
Right. So, you know, I'm an N of one, but I would ask, in your experience, you know, with all the hand washing and mask wearing, have you had a cold in a while? And the answer is, you know, no. You know, so that is right. So we're going to see the impact of masking and hand washing and distance. Natalie, I'm not sure. Do we have time for one more question?
I think we've answered all the questions
Perfect.
At this point.
Well, that was serendipitous. So this is going to conclude our session today, and I would say that if we have impressed upon you that, number one, we're thankful to our alumni for their support, and that we have been actively and fully engaged in this in the tripartite mission of protecting our community, continuing our missions, and partnering across the state. I hope you will take that as our sincere interest in leading this institution. So please take advantage of the rest of the reunion activities, and we'll look forward to seeing you later. Take care. Be safe.